Okay, so I think we've got everybody here at the moment. So thank you so much for taking the time to join our group session this morning at ActiveNet. So this session will be looking at the workforce needs, and that will be focused around preparing the workforce for the future needs for the sector and looking at referral pathways as well. So I hope you enjoyed the keynote session. I hope you found it quite interesting in terms of where we're at as a sector at the moment and how we can work together more collaboratively moving forwards as well. So we have a really interesting panel with us this morning. So we have representation from Tara Dillon, who is the Chief Exec of CIMSPA. We have Jacqueline Lynn, the Head of School and Community from Sport Scotland. We have Flora Jackson, Improvement Manager from Public Health Scotland, and David McLean, who's the Head of Operations Development from Edinburgh Leisure. Folks, we have around about 40 minutes this morning. And what we are going to do is I'll ask each of our panellists to introduce themselves one by one and let us know who they are and what role it is that they have within their organisation. Then what we're going to do is we'll have a roundtable discussion fundamentally about at the moment to prepare our workforce for the future needs of the sector, but also what we will have is we will have time towards the end for any questions. So if you have any questions at any point, there's a chat box down at the bottom of your screen. If you wouldn't mind putting your questions in there, and hopefully we will have the time towards the end of the session to ask the panellists those questions as well. Folks, what I would ask is if you don't mind putting your cameras on, if you're comfortable with that, that would be fantastic. And I will start off by passing across to David. David, could you introduce yourself to the group, please?
Good morning, Susie and everyone. Hi, I'm David McLean. I'm Head of Operations Development for Edinburgh Leisure. I head up the areas of the business that cover fitness, sports coaching, aquatics, our centralisation in customer inquiries and customer accounts. Edinburgh Leisure, as I'm sure some are aware, but not all, are a charity, and we're a not-for-profit organisation, where every penny that we make goes back into the business, whether it's through facilities, products, services, and that of what our active communities team deliver. Look forward to speaking with you all later.
Brilliant, thanks for that, David. Jacqueline, if you wouldn't mind if I hand across to you next.
Thanks, Susie. Morning, everyone. Nice to see you all. I'm Jacqueline Lynn. I'm one of the heads of sports development within Sport Scotland. I have a responsibility for our work with our local authority partners and leisure trusts, and then the work around active schools, hubs and clubs, and our approach to changing lives, which I know, just seeing a number on the faces on the screen, that some of you have been involved in that. So looking forward to the session and looking forward to the questions. Thanks, Susie.
Brilliant. Thanks, Jacqueline. For our next two panellists, if you were in the keynote session previously, you will have already had an introduction from them. However, if you weren't at that session, Flora, if I can hand across to yourself for an introduction, please.
Yes, certainly. Good morning, everyone. So I have an obscure job title of Health Improvement Manager, which can kind of cover a jack of all trades, but it has a specific focus around physical activity, and I've gladly been able to retain that for a number of years. That role is quite diverse. It involves working strategically with a number of different partners to influence the public health aspects of their work. It also involves providing advice and a certain degree of influence, I'd like to say, towards Scottish Government as well. I'm sure they maybe think otherwise, but we try. We also look at the Chief Medical Officer's physical activity guidelines. So we're also charged with looking at how we translate them into meaningful practitioner workforce fit, if you like, information. So that's a little snapshot of my world. Thank you.
Great, thanks, Flora. And last but not least, sorry, Tara, if you wouldn't mind introducing yourself. Thanks.
Good morning, everybody. Thank you, Susie. It's my pleasure to be here this morning. So I'm the CEO of CIMSPA, which is the Chartered Institute for Sport and Physical Activity. So we're the professional body for workforce. And currently in Scotland, we have a signed MOU working with Public Health Scotland and Sport Scotland on the skills agenda. And we provide secretariat and the chairmanship of Mr. McLean for the Scottish Professional Development Board. And that board is an employer-led board that identifies skills required in Scotland and the professionalisation of our workforce in Scotland. So that's our function. I hope that helps. I've just been on the keynote, so I don't want to bore everybody.
Great, thanks for that, Tara. So myself, I realise I haven't actually introduced myself. So my name is Susie Benson and I am also Regional Partnerships Manager at CIMSPA. And fundamentally my role this morning is to help to guide some of our discussion, so to draw out some of the learnings that we can take from our panellists in the session this morning. But fundamentally, David Monkhouse from ActiveNet had asked myself to help to support this session. What ultimately were I suppose the key challenges and the key priorities for our sector in Scotland as we move forward out of, hopefully, post-pandemic, but also probably and most importantly is what we need to do now to start to create that trusted and respected and confidence in our sector that we need to help to take that collaborative approach. So I think from the keynote, you probably all heard that the key word that was coming out from every single panellist was around collaboration and what we can all do together to help to improve our sector and the links with healthcare moving forwards to, again, it's a common phrase that's used to reduce that burden on the NHS as well. So fundamentally at policy and at strategic level, organisations such as Public Health Scotland, Sports Scotland, we have Community Leisure UK, UK Active, CIMSPA, the Scottish Leisure Network Group and many local authorities and leisure trusts are looking to support that more collaborative link between leisure and healthcare. But fundamentally, there has been a nod to the fact of we can do all this work, but what is it that we are doing to help support the workforce to make sure that they are supporting the needs of our participants and the needs of our system as we move forwards. So what I'd like to do now is I'd like to hand over to Tara, basically to kind of set the scene from your perspective, Tara, as the Chief Executive of CIMSPA and the professional development body, and actually what your viewpoint is on this general topic to get us kicked off, please.
Thanks, Susie. Well, I'll begin by stating the obvious, really, is the thing with the health agenda and delivering activity through leisure trust, through private sector, through sport, through communities. We've got a fantastic sector that innovates, and we've seen that at its very, very best during COVID. The ability to, in a very agile way, pivot the services that we provide while we're shut down is fantastic. One thing I say to everybody about our sector is that we've got brilliant facilities and we've got fantastic community facilities and we've got amazing stadia and we've got great kit and we've got great tech and we've just got, iconic buildings. But none of what we do works without people. And activity levels are embarked upon, increased or maintained by a relationship that a participant has with a coach, with an instructor, every single time. So the focus on workforce, it can't be underestimated, can't be understated, but actually needs to be a key priority for every part of this collaboration. If we have a challenge when it comes to working with the health sector, and Flora touched on it actually in the previous session around trust and confidence. We don't have a long way to go in terms of inspiring or inducing some confidence and trust from the health fraternity, but we do have to have a construct that looks a bit like them. So I worked with some of the Royal Colleges some years ago, and there was overwhelmingly, we understand how important your sector is to prevention. We understand now that in rehabilitation, post-acute phase, in the last 5-10 years, we worked out that we used to send prescribed bed rest to people, and we worked out that prolonged symptoms or slow recovery wasn't actually the disease, it was inactivity. So we need your sector now more than we ever have, and only 25% of those who present acute symptoms actually get seen, and therefore look at what Flora does for a living in terms of prevention and health improvement. You are key to that. So I remember saying, brilliant, well, that sounds very encouraging. What's the problem? And they said, we just don't understand your workforce. So I asked them, what would you like the workforce to look like? And it was look a bit like us. So first of all, what is a standard to be qualified as a PT, as a fitness instructor, as a coach, etc.? What would we be looking for that we know and trust? And to which I could say, well, we have professional standards. We're developing those in Scotland. That's an easy one to tick off. Well, that's okay then. And then we want those abilities and skills to be maintained through professional development, to which we replied, well, that's also an intention and an ambition of the PDB in Scotland, so that's okay. And we'd also like them to have some status. So we said, well, that's fine as well. I mean, CIMSPA can provide that. It's what we facilitate. So to be able to differentiate between somebody who, perhaps Susie, you qualified yesterday as a PT and I've been doing it for years and I've been building up my CPD portfolio, is that my professionalism is recognised. I'm not saying that you're not, but I've got lots of experience and lots more CPD developed over the years and testimonials, and I work with different populations, and I can prove that, is to add some status to me that gives me chartered. Now, you speak to Flora, that type of language appeals very strongly to our colleagues in health. So that's the premise of the work that we're supporting the Scottish Professional Development Board with. I'm working with Public Health Scotland, and we'll talk about referral pathways later. But it's progressing at a pace. And I'm very, very encouraged by the enthusiasm and willingness of operators in Scotland to make that happen.
Great, thanks for that, Tara. I think there's definitely that element of especially even when we look at the language that is used and actually how we can create that trust and confidence from, if we think about healthcare, and actually how it is that they perceive people that work within sport and physical activity and what those links look like. David, I'd be quite keen to hear your thoughts on this topic area, but also just linking back to what Tara mentioned there. So you are the chair of the Scotland Professional Development Board. Also in your day-to-day job, you are dealing with a workforce who are directly out there delivering and on the ground with people who do come through referral systems as well. So could you tell us a bit about your thoughts on this area?
Yep, thank you, Susie. Without going into too much of history initially, but I will give a little bit of context. This journey started for me around about 8-9 years ago, when I took the decision as fitness manager that, in those days, it was everybody had to be a minimum of level 2 to deliver on our gym floor, but then stuck in the desirable that within 2 years, every gym instructor that worked on Edinburgh Leisure's gym floor needed to have an exercise referral level 3. Jump forward to 2016 and then embraced and joined CIMSPA because I believed in everything that the Chartered Institute were doing with the vision, the strategy up to 2021, which is why, again, we wanted 100% of our staff, and when they join us, to be at least practitioner and affiliate, to then have practitioner status with and through exercise referral by that stage. What that's enabled us in Edinburgh Leisure to do and help to the position where we are currently, to where we're proud of at Edinburgh Leisure with regards to health programming and our active community delivery, is it's given our staff on the gym floor who members through self-referral, whether it be through single or multi-condition, our team have a knowledge and a skill in what they can do to help them with what their goals are, and coming from inactive to active or helping keep people active who are already active with us. So that was a good start of the journey for us. What we've also seen, and through our active communities team and the growth within that, is the progression for our gym team moving into the health programme. So now with Edinburgh Leisure delivering over 20 projects around health and that priority of the inequalities as well. For us, this is where, we feel, as I say, we're proud, but it's only scratching the surface. And in coming into, as you've both alluded to, the chair of the CIMSPA board, that's what drove me to come onto the board. It was around that professional development and being part of the early days with some of the standards being set around exercise instructors, through fitness classes, gym instructor, personal training, just that whole professionalisation for the industry and recognition for professionals delivering in the industry. That's what was so important for me. And I do believe, as Tara said and Flora in the last one, we're definitely a lot closer. And like I said, from our active community delivery point of view, with over 230 local community clubs and charities that we work with closely, the thousands of people that we see each year, helping them with their activity. We're definitely along the road, but it's definitely not a full solution yet. And the CIMSPA board and what they're working on at the moment, both from the operational plan and also hopefully by the end of this year, having that skills strategy that will help position us and the workforce for the future. That really does excite me. And then having some policy around about that as well, about who can, and enabling more of our staff to deliver what the needs are and where we can be more helpful as part of this health and social care service solution.
Brilliant, thanks for that, David. I think there's an element from me that you touched on there around that inactive to active population group, and actually within your community team, or active community team, sorry, the work that they are doing to help to support those networks and support those individuals that are in that current circumstance of, right, okay, what do I need to do to start to actually live more actively, but how is that going to impact on my health in general? Jacqueline, if I can just come across to you now, just I suppose ultimately thinking about that inactive to active side of things. Now, I'm aware that Sports Scotland have been working quite heavily on this agenda for the past few years, and ultimately links in with some of the work you have been doing around changing lives and that inclusion across the whole spectrum of population in Scotland as well. Can we hear some of your thoughts on this, Jacqueline?
Yeah, no bother, Susie. Thanks very much. I guess just a bit of background just to come in and then answer Susie's questions. I think the main thing for us over the last 18 months is really to be supporting partners. And, yeah, our main focus is with local authorities and governing bodies, but we've actually widened that much. That's been much wider in the last 18 months about just helping partners to get through the pandemic and to support them to recover. And I think we've recognised the challenges for all partners, but what's become very open for everybody is that we're actually, from an inclusion point of view, the inclusion and inequalities is getting wider, and it's how do we work to actually look at that. And I think that's a big thing for the sector to take on, and I think this is a real opportunity for us to think differently, and I think that's the most important thing from today. How do we think differently? And Susie was mentioning that collaboration came out of the keynote, and I think that's where we'll get that. We've provided guidance and support regular to everyone around the sport specific guidance with the governing bodies to make sure we can get that up and running. You've got getting the facilities ready for sport, getting the coaches ready for sport, our club and community organisations, so that the sector as they are and the workforce that's there's been guidance to really align with where government are in those restrictions. The feedback on that's been really positive, just to help the sector look at that. And I think the next stage is that, where do we take that now? So we'll continue with that, making sure we're keeping the facilities ready. And I guess when we say Sports Scotland, making sure you guys are keeping the facilities open and going, because we're not responsible for that. You guys deliver all of that. And then obviously the workforce. Our main focus will be on inclusion with the 32 local authorities, leisure trusts and the governing body. But what does that mean, and how do we make sport and physical activity more inclusive? And how do we reduce inequalities in sport? And that's a key driver for us. And the big thing for us, and it'll be important as we see everyone around the screen, is really focusing and driving inclusion with a number of our local authority partners. So how do we join that up on the ground? How do we join local authorities, leisure trusts, governing bodies, private sector, health and social care partnerships, the community planning partnerships? And that's a big ask of all of us. But from a people point of view, it's about us all understanding each other and recognising what role we actually all play in that. From the system, people are a huge important part of our system in terms of that, and the workforce plays a significant role, and I think that's the importance of today. We need to understand what the workforce needs, how do we help them recover, and is it still the same as we're going through this? And that's where, if we bring in our changing lives approach, I'm sure a number of you hopefully are actually been on some of the cohort or listening to some of what's come out of the Changing Lives. But all of that is why are we doing this? And showing that sport can intentionally drive wider outcomes and really looking at those inequalities. And that's been a challenge. It is a mindset thing, and we call it a changing lives approach. But once we've embedded that in all the work across the sector, at the moment we're rolling that out around active schools, community sport hubs, governing bodies, and then it will go to the coaches, the leaders and volunteers. But I guess there's a bigger sector there as I look around the screen. What about the facility operators? Where are we with that? How do we make sure we engage much wider around that? And I think at the moment, what we've seen through the whole pandemic is just an amazing workforce. And that workforce have adapted and flexed throughout all of this to really deliver amazing services for our community. And that's the people that are in your teams, that's the coaches, the volunteers, the deliverers, that's in the clubs and the community organisations. How do we make sure we build on the partnerships, we build on the different approaches, but we make sure that workforce has got the skills, abilities and confidences? Because we know with our chats with Community Leisure Scotland, there's a risk that we're going to lose a lot of staff. So how do we make the roles and the jobs fit, that they want to come and be part of our sector? Because that's where the excitement, because you can really change people's life and contribute to a more active Scotland. My last bit, Susie, is just around the importance of partnerships and that collaboration. We're excited by our partnership with CIMSPA, which is great because it really ties us into where we're going with the workforce and gives us great opportunities. Obviously, we have the partnership with Public Health Scotland, which is really looking at that preventative agenda. How can we take all the health boards that are across the country, connect them to the local authorities, but more importantly, meet community needs? And that's a big thing. UK Active and, also Community Leisure Scotland, but we've also got other partnerships with SAMH, with Scottish Sport and Futures, and with education. And these are the partnerships we all need to learn from. How do we use and how do we get our workforce upskilled, and a lot of the things that are happening in these environments as well? Because I think the mental health is a real important thing, and the mental health of the workforce is there, and partnerships with Public Health Scotland and SAMH really help us drive that. I think the pandemic's been awful for all of us, and I think we've all lived and breathed over the last 18 months, some highs and some lows, but I think it does give us a real opportunity to be creative, to be bold, think differently, and make sure our workforce is the best it can, so that the people in the communities get a brilliant service and we do really reduce inequalities. So that's probably where we are, a lot in there, but hopefully it just gives you a sense of what we're trying to drive with partners.
Absolutely, thanks for sharing that, Jacqueline. I think there's a couple of a few really important themes that are in there, but I suppose one that's probably quite prominent at the moment for a number of you that are on this session just now, just nodding to the recruitment challenges that we have had. So we've recently conducted an employer kind of health check survey, basically because we've been receiving a lot of feedback about challenges within recruitment and losing people within leisure ultimately to other sectors throughout the pandemic, and with the whole kind of pandemic aspect as well, and making a real impact on operations. So there is definitely a challenge with that we need to look to address moving forwards. But I think also, Jacqueline, just to go back to your point around your kind of main focus on inclusion and also those partnerships, and there is a common theme for me in all of this, is that actually, Flora, I'm going to come to you next. Public Health Scotland are heavily influential within this whole area. So again, the work that goes on with sport, within sport and physical activity, can hopefully make a huge impact within the overarching health of the nation. From a Public Health Scotland perspective and the links that you have with the organisations within sport and physical activity, can you give us a bit of an insight as to where you're at, Flora, and Public Health Scotland, and how those links have came about and what that means to you?
Yeah, absolutely, Susie. So where's the best place to begin? Right. So if we were to think about where the sport and physical activity sector fits, I see that very much as part of a whole system approach to physical activity or public health. So the physical activity part sits within the broader context of public health. So in that sense, it's absolutely integral. It's absolutely key. So over the last couple of years, obviously, we've developed now a formal partnership agreement with Sport Scotland, which creates a whole host of opportunities. It's also allowed me to better engage with the sector strategically. So Sport Scotland are facilitating a strategic forum for sport and physical activity, which has all the key stakeholders at the table. So I'm fortunate enough to also be at that table. So it allowed me to have a much better understanding of the needs of the sector, and also to share with the sector some of the realities and some of the things, the ins and outs and goings on of public health, but also the wider healthcare system in Scotland as well. So it's been a real bringing together of minds and sharing and getting a better understanding of one another's agendas, key drivers, and really getting into the heart of that. At a more practical level, we've been working with stakeholders across the sector to look at particularly at physical activity referral. And we've done that for a number of reasons, and the main one being that we were really keen to ensure that the health sector valued the important contribution that the sector makes to health. And we felt if we actually support and worked with the sector to develop these particular physical activity referral standards, then it would be far more likely that the health sector itself would take that on board. So that's ongoing, very live piece of work, something that we hope to share more broadly in the coming months. So watch this space, because those standards will be coming out very, very soon. The other rationale for doing that was that when we looked at the services that were provided, there was a huge variance in terms of quality and accessibility. Some areas just simply didn't exist. So we hear these horrible scenarios about postcode lotteries when it comes to healthcare, but actually when it came to it, we were trying to encourage our health colleagues to promote physical activity. The reality was that in some areas the services were not just quite there, and also that led to elements of distrust, I think, which rightly or wrongly, some of that just comes down to miscommunication and misunderstanding and perhaps past experience of the sector. So we need to do a really, really good selling job from within public health to actually upskill our own workforce within health to make them aware of the benefits of physical activity and the value that the sector brings and how best they can utilise it. So there's quite a lot on the go. I'm quite conscious also that if we look at what the workforce within sport and physical activity needs to do, I guess, to bridge that gap, then it's about better understanding our communities, which was the point I ended on in the keynote. And the reason for that, because I think it's fundamental, we have a key role in terms of not just prevention, but early intervention and also the management and treatment of long-term conditions. So if you take that approach and you think of it in that context, it pretty much takes in the entire population. So that's where we need to get better at understanding the data that exists within our communities, understanding the people within our communities, understanding their individual health needs, understanding why they don't ever cross the thresholds of some of our facilities, they don't ever come in contact with our staff. Let's look at how we can bridge that gap by understanding their very specific needs. If we're able to better target our interventions and approaches to meet their needs, if our staff are skilled in terms of their knowledge around health behaviour change, being person-centred and tailoring activities to their needs, then they're far more likely to succeed. So again, I think if we take that all together as a package, then by the end of it, if we're able to do that, then we create a scenario where we have really quality services, really knowledgeable and highly skilled workforce within sport and physical activity and within health that understand one another's worlds and that are then better able to serve the needs of the Scottish population.
Great, thanks for that insight, Flora. I think, again, kind of hugely prominent, and I'm going to come to David in a wee second, just in terms of, so when we were talking about this from Public Health Scotland, CIMSPA, kind of Sport Scotland strategic level, and this is the vision hopefully that we want to strive to achieve to in years to come, and making that system better. But I suppose fundamentally, when we look at how that then transfers to the more operationalised aspect of it, so David, from your side of things, where, and I suppose what support would you require as an operator to help to support and drive that within your staff and their development, and how to then directly deliver that service, I suppose, on the ground?
think something that's been touched on a few times, earlier session, the start of this one, it is that collaboration. And as Flora said there about understanding the needs of the community and what's going to help them bridge that. So it's about how, and there's standards out there, for physical activity instructor, etc. And it's about some of that communication at ground level. But I do believe organisationally, the next stage for us is how we, ensure we're sustainable coming out of what we've just all been through for the last number of months. But also, it's like Kirsty mentioned it earlier, it's about securing funding and then ensuring that what we are doing is actually reporting and becoming part of that data picture. It's something that we talk about now, even just from our mainstream gym membership. How can we demonstrate the impact that we are having on what we're doing? So we've got it through some targeted programs, we've got our software on impact, etc. And there's other good providers out there that are delivering that type of information. I do think as an operator, one of the things that we need to get better at ourselves internally is demonstrating that impact of what we are doing and how that is affecting people's lives and what difference is that making in our communities. That to me is something that will help engage further and gets the buy-in wider into the community, but also from our own staff ourselves, from what we're delivering and seeing some of the results from it. Because it's great that they get some of the anecdotal for the people that they work from, etc. I do believe, organisationally, strategically, it is about, sustainable, how we grow our fund and how we become part of, and work in collaboration across a bigger number of organisations. But there is that belief and growing belief that what we are doing is effective. I mean, currently, I think we're receiving around 400 referrals per week. How do we get that to 4,000? And that is about, skilled workforce, having the workforce available and the funds available to deliver, the future needs of the business.
Great, thanks, David. And I think Jacqueline, I suppose, kind of links in a little bit with a lot of the work that Sport Scotland have been doing and that I'm aware of over recent years about there are kind of hugely invested programmes and lots of different initiatives to help to support your invested posts. So your active schools coordinators, community sports hub officers and governing body colleagues as well, with regards to, again, going back to that inclusion, changing lives. But I suppose fundamentally from an impact perspective, are there any learning points from the way in which you measure impact that could be used to help to support some of the operators out there, such as David, who is looking to better understand actually what impact are his workforce ultimately having on the communities and the services at the end of the day?
Thanks, Susie. I think the Changing Lives approach has been certainly a journey for us, and we're just about to get the final report about that, of the impact of this approach. And some of the key things that have come out of that, there's a messaging about how we can why we're doing this and how it can actually contribute to, that sport and physical activity contribute to wider outcomes. And it's that intentionality of why we're doing that. The second thing is then there was projects. So there was 17 projects of bringing together a sporting and non-sporting organisations to work together, and that was the whole focus of the projects. And what we've seen through them, and this is anecdotal learning at the moment, and they actually through the pandemic, 5 of those projects have managed to keep going, which is quite remarkable when you think a lot of them were voluntary projects on the ground. So the learning out of this is when you bring people together, they start to understand the different needs and what's there and how they can support each other. So that's been a great pathway for us. And the final bit of that is then about upskilling our workforce in terms of the active school coordinators, community sport hub officers, sports development, and our governing bodies around understanding this approach. So that will hopefully they can embed that in their work, and then everybody understands why you're doing this. And going back to that reducing inequalities and about inclusion, then you understand the needs of the community, and that's the biggest driver. And how do we do things differently in terms of all of that, Susie? I see Ian's always also put in the chat just around changes and initiatives about physical activity and mental health. Probably, Susie, if you don't mind, I was going to put it in the chat, Ian, but it's just around our partnership with SAMH. So over the last probably again 2 years, just before the pandemic, we started a partnership with SAMH, and that was really around understanding that we all have mental health and what is that spectrum of mental health. And what we've done now is we've worked with SAMH and their team in sport and physical activity to provide a route map and that's about training for the workforce to understand the stages of how do you have a mental health conversation, what does that look like, what does that then mean for the children and young people that are coming in, or your coaches and volunteers. So we're at a level with that at what I would call our professional staff, but the next part of that is then how do we get that to the clubs, the coaches, the volunteers, and links really nicely, I think, with what Tara was saying is how do we meet the needs of our workforce, what things can we get in place, and opportunities like this where we're working with other partners that are not traditional sports partners have been really successful for us. It's learning that expertise from other people. So hopefully that, Susie, answers both your questions in terms of all of that. And as soon as we get the research, clearly that'll be shared, because it's with Spirit of 2012, government, ourselves and Robertson Trust as funding partners as well. So a lot of learnings come out of that for us.
Brilliant, thanks for that, Jacqueline. That's a really good insight as to, again, the partnership with SAMH and looking to support that kind of wider mental health side of things, and how you are supporting that wider sector. Tara, I'm just going to come over to you next in terms of physical activity and mental health across the workforce. I suppose fundamentally there's two aspects. Now I'm conscious of time and we've just got a few minutes left. I suppose, Ian, just nodding to your question, I'm not too sure whether you're looking at the entirety of the workforce across the sector or whether you're looking for it from each individual organisation. But I wonder, Tara, whether you could give us a bit of an insight from your side.
Yeah, thanks, Susie, and great question, Ian. We ran a survey, a UK-wide survey in September, and against the national average, our workforce was something like 14% higher level, a 14% increase in incidence of mental health during the pandemic, and then pre-pandemic similar levels. But it was remarkably high. It was over half of the workforce suffering mental health issues. So we immediately worked with organisations that Jacqueline's alluded to, SAMH and Mind, and there are so many organisations out there trying to do really, really good work, but not actually connecting with a sector like ours. So we've taken great strides to ensure that the work that they've got is available, you know, and it's tangible and it's bite-sized, and I can pick something off. It speaks to me, it's relatable, as opposed to, do you suffer with mental health? Pretty open-ended question. Here's a phone number, here's some sort of self-help. It was very relatable, and you could touch and feel it. So, and what we'll do, Ian, is we'll continue to run that survey year on year on year on year to make sure that we have a benchmark and we can see that the interventions that we're making are making a difference. And through SLNG, through the PDB, through Sports Scotland, we'll make sure that's available, that some of those solutions are available. And Susie, if I could, I just want to go back to something that Jacqueline said. And in actual fact, all the panel, we're now at a point where a pragmatic approach is needed to sort of, you know, stepping up around the skills agenda. And we're waiting now for the Changing Lives data. We're very excited. Thank you for giving some anecdotes, Jacqueline. We know it's been positive, but from that, where we've got anecdotal evidence of real success in a location, right? So this is what I talked about in the keynote, population-based networking that coalesces around systems approach to change, right? As opposed to a theory of change. So we're theoretically the solution to National Health Scotland's, you know, burgeoning problem with COVID, full wards and not enough nurses. That's a hell of a bold statement and very difficult to qualify and quantify. Where it will make a difference is in a location. So Changing Lives data will tell us where those successes are. And then we'll work together to say, what was the model that a successful pilot used, and how can we apply that model to other locations in 32 authorities in Scotland? And what were the key drivers that made those partnerships work? So it would have been the Territorial Health Board, worked with the local authority, who worked inclusively with the leisure provider. They identified 3, not 300 priorities for that location that will make a difference economically, socially, and physically, right? So the health piece. What was our sector's contribution to that? You know, we can't fix everything, but what contribution can we make? This. Okay, do we have the skills within the workforce to achieve that? By and large, we do, through fitness instructors and coaches and volunteers. But what if we had these health navigators, community activators, people with the skills for long-term health conditions or specific health conditions, working in partnership with local health providers? So not reinventing the wheel. We don't want to become health practitioners, we're activity practitioners. And educating those local health partners in the power of activity. You know, people study medicine and the benefits of activity is not included in their learning right now. It's CPD. So in addition to that, we'll develop local skills improvement plans linked to the location that says, here's the outputs, here are the priorities, here's what it will do. This is the benchmark and what it will achieve. It will save the location money. It will improve social cohesion. It will tackle inequality through deprivation or reducing deprivation or appealing to people in communities of deprived areas. Therefore, we're going to need some skills. We'll then work with the universities, our training providers and local colleges to provide those skills, which, by the way, attracts funding, which doesn't get funding at the moment. It's being cut off at the knees, because we can then show Education Scotland that it's employer-led and it relates to a location, and then it becomes an ecosystem. And if you put all of those ecosystems and all those improvement plans in place and connect them together, then you achieve a national strategy. And then we can probably boldly say, in different areas of the country, we have reduced the burden on NHS Scotland, rather than state it up front and then not have a plan to support it. So it's powerful and it's tangible and it's happening. Thank you, to Sports Scotland, Public Health Scotland and the Professional Development Board, which is where the employers and deployers of our sector really make a difference.
Brilliant. Thank you so much for that, Tara. I think in the, I suppose, conscious of time that we have ran over ever so slightly. However, just in summary of that discussion, I think there's kind of 4 key elements for me that have come out in all of this. Is actually, firstly, being able to understand the needs of participants. And when we talk about participants, that doesn't necessarily either need to be somebody that goes to the gym kind of 7 days a week, or somebody that takes part in sport regularly. From a public health perspective, that could be a participant who actually walks outside the front door of their house into an outdoor environment to become active. Secondly, there is a real need for development across the workforce, and we need to start to plan and prepare some of that now, building upon knowledge and research that we already have, which links in with the impact. So what impact is it, thirdly, that we are looking to make with the workforce, but ultimately what difference is that making in our communities? And lastly, and by all means absolutely not least, is that link and collaboration across all organisations. So between those 4 key elements, if there is an aspect where we all work together, we're all striving to achieve the same thing, then ultimately when we look at the resources that we have, how can we better utilise them moving forwards to make a real impact on our whole environment, but also the workforce within that as well. Folks, thank you very much for your time. Thank you so much to our panellists this morning. I very much hope you enjoy the rest of your day at ActiveNet if you're continuing for meetings. I realise that we have run 5 minutes over, so I hope that you still have enough time to grab a cup of tea before your meetings at 10 to 11. But thank you all so much for your time this morning. Really appreciate it and have a good day.
Thank you all.
Thank you.